Good morning. This is Dr. Tariq. Today my topic is skin burns. The skin is composed of three layers: epidermis, dermis, and subcutaneous tissue. Burn is an injury to the skin due to multiple reasons. Number one, dry heat. Number two, hot fluid, which are called scalds, chemicals, radiation, electricity, and friction. They all cause skin burns. The severity of the burns depend on two factors: the depth of the skin burn and how much percentage of the body surface area is involved in the burns. It is difficult to estimate the losses due to electric burns because most of the damages are under the skin and cannot be estimated from outside. Electric shock damages the muscles of the body, affect the heart, which is the muscle, and it breaks the bones and it damages the RBCs. Electric shock, there is electricity going on in the heart that causes contraction and relaxation of the heart, and this electric shock can cause dysarrhythmias in the heart. When muscles are broken, they release myoglobin in the blood, and when RBCs are broken, they release hemoglobin in the blood. So there are too many myoglobin and hemoglobin in the blood, and when they will pass through the kidney, will be excreted through the kidney, they can cause acute tubular necrosis and even renal failure. The burn produced by the radiation that happens in case of radiation therapy if the patient is suffering from cancer. On the depth of the skin that is burned, the burns are divided into 3 degrees: first degree, second degree, and third degree. As I told you before, the skin has 3 layers: epidermis, dermis, and subcutaneous tissue. The first degree, only the superficial layer is involved, that is called epidermis. These burns are also called superficial burns. Superficial burns, the skin will be red, swollen, and extremely painful because the pain receptors which are present deep in the dermis, they are intact, so it will be quite painful. Number two, the superficial layer of the skin, epidermis, and plus upper part of the dermis are involved. This is called partial thickness burns. This skin that is burned, it will be swollen, red, painful, but characteristic of second degree burn, there are blister formation. Blisters will be there. Third degree burns, they are also called full thickness burn. All the 3 layers of the skin are burned: epidermis, dermis, and subcutaneous tissue. Even sometimes the deeper tissues like muscle and bones, they are also burned. The area involved, there is how much area is involved in the burn. To calculate that area, there is a rule that is called rule of 9. We divide the body into 11 nines. 9 multiply 11, 9 and multiply by 11 is equal to 99, and 1% is for the genital area, and that equals 100%. So we assign nines to different areas, like 1 9 for head and neck, 4.5% for front, 4.5% for back, 1 9 for head and neck, 1 9 for front of the chest, 1 9 for front of the abdomen, 1 9 for back of the chest, 1 9 for back of the abdomen, 1 9 for each arms, 4.5 for front, 4.5 for 9. 2 9s for each leg, 1 9 for front of leg, 1 9 for back of leg. So they are 2 9 in the arm, 4 9 in the trunk, torso, 6, 2 in one leg, 2 in one leg, 10, and 1 in the head and neck, 11. So if we multiply 9 with 11, that comes out to be 99%, and 1% is to the genital area, it becomes 100%. That is all about skin burns. Thank you.